There you go. I'm recording it now. Yeah, so here we go. So the first thing I was thinking, a typical consult, like I saw, we take a normal history, and then I try to do some just running specific questions as well, which I'll just go over in a second. And then the next thing I'll follow up is then actually getting them out on the treadmill to do a bit of a run. I always follow people's guide, like if they do want a little bit of manual therapy as well, I'll help them out with that at the end if we have enough time. So say, for example, if one of you refer to me for a running assessment or analysis, they have an Achilles injury, say, for example, I'd take a few more questions specific about their running. I'd get them out on the treadmill, and then I would follow up maybe with some calf work and some work through the plantar fascia or mobilize the ankle. So generally that's what I do. And then the running assessment to start with is just 45 minutes. And then I do a follow-up 30-minute retraining session as well. The retraining one is pretty much people generally, you tell them what to do once, they go away and try to do it, and they come back and they're not doing it again, or they've changed or modified it to a degree. So just make sure that they're on track. And the evidence generally says 4 to 6 of those kind of within the first couple of weeks or month is ideal. I haven't done that as frequently so far, but that's kind of what the evidence says. So you can do that for someone if they're really wanting to follow up quite a lot. The one emphasis that I always have is load management. And that's kind of the key that I spruik with all running assessment and running injuries. And obviously having that conversation about education is really important for people. They're not going to get better just from running differently necessarily. Like if they're still going to pound the pavement just as much as they typically have, they might find themselves in strife or their injury is not getting better. So you can kind of see their training errors or excessive load account for up to 80% of injured runners. It's not necessarily like the exact biomechanics of what they do, although that can contribute to it. A high vertical loading rate, which is just kind of those ground reaction forces coming back up, is linked with injury, which is of course like changing your loading, so we can modify how much we're putting force down into the ground, and as a result the force is coming back up into your ankle, knee and hip. And obviously with that we have how strong someone is, so how much they can actually withstand the vertical load or the load going through them, and then how they can control it as well. All those things kind of go together to create and encourage someone who is more efficient at running or smooth to reduce their loading. If you have a look at the little graph or the little table on the side, a lot of typical corrections with people generally are increasing their cadence. Reducing shoe interference is pretty much, some people might run with really a large stack height or a large heel. That one for me at the moment, I often refer a bit more to Kari. Obviously when it comes to footwear, that's her realm, but the people that I got this particular diagram off, they spruik kind of a minimalist style of shoe that allows you to, for your foot to naturally splay, and you normally load a little bit more on the forefoot as a result. And other things that I really like to look out for is that reduced noise. You can really hear when people are smashing down onto the treadmill, or if they're actually really light, and that sometimes you don't see a difference or much of a difference on the treadmill assessment, but the noise level goes down significantly, clearly telling us that we have lower impact forces. The last kind of 2 dot points on both of those graphs there, a rear foot striker normally puts more pressure on the anterior part of their their leg, their knee, hip, and spine, where the more forefoot or midfoot striker puts stress on their foot and also the posterior leg. So obviously someone who's landing on their toes, like their Achilles and the calf, is going to be doing a lot more work than someone who's landing on their rear foot. And I also really like the model of going back up to the top of appropriate stress equals positive adaptation, where excessive load equals degeneration. And I guess the excessive load equals degeneration is often like a model that's fruit with runners, like don't run, you're going to wear out your knees. But if you do anything appropriately, as we know, it will lead to a positive adaptation, not degeneration or wear. These are things that I look out for, and obviously you guys probably talk about them a little bit as well. But when we're looking for those training errors, we're looking at obviously their running volume, and often that's their volume per week. And we'll also ask about, I guess, the intensity of that particular session as well. So some people might injure themselves by going 100% at every session. So that's something quite common. Or they're going low intensity at the sessions, but their running volume has jumped from 20 to 35 kilometers per week, or from 20 to 50K per week, and it's just too much for that person to handle all at once. Their sessions per week, and again, their footwear. And I like this little graph here as well, the stress over time. And I think it just highlights that we just need to take note of how much someone is stressing their body. And we can manipulate that pretty easily by changing all these variables as well. Like, for example, running surface, someone who has an Achilles injury, if they're running on the heels all the time, then if you just put them like on a flat surface, then they're going to be offloading their Achilles straight away. And that might be the only change that they need. Typically the things that I'll do, which everyone will do as well, to test for that strength and control, single leg calf raise to test more for the gastroc, or bent leg calf raise for the soleus, to make sure both of those are really strong. The soleus is one of the major powerhouses with running. If you find that that's weak, then it will translate into obviously being slower, but also an inefficient system. I do isometric glute, quad, hamstring, psoas, just depending on what that person is feeling. A single leg hop will just tell us how obviously their knee is loading, but also listening for the sound again. If they're really harsh and hard, that might indicate that there's a bit of weakness in the chain. Squat and a single leg squat. And then these might be done that session, they might be done the next session, but it kind of all try to entail that whole lot into a few sessions. Obviously, someone who's really, really loud on the treadmill, you can quieten them down, but being loud on the treadmill also translates to being often weak or uncontrolled as well. So what I look for, typically we try to do like a head to toe analysis. We look in the sagittal plane first and then the frontal plane second. The first things that I look out for is cadence. An optimal cadence is around about 180 beats per minute or steps per minute. Do any of you ask about cadence when you're treating runners at all? Yep. Good. Other things like I was talking about a second ago was loading sounds as well. That's really important and can tell a lot. The other day I had someone who just one leg sounds really, really hard. The left leg was smooth, didn't hit the deck very hard. The right leg was really slapping a lot. So again, that tells us a lot of information as to why, like they were getting more their shin splinty type of pain on that right-hand side, or stress syndromes. Head position, shoulder position, arm position, and how it swings. their trunk position, and then of course getting into that lower leg where a lot of the work is being done, their pelvic position, and hip drop, and how their knees are moving, valgus or restricted hip extension, and then how they're landing as well after that. Any questions so far? Yep.
The only thing I just
common things that we're looking for are overstriding, which we'll see in a second, and anterior pelvic tilts. Is there any questions? I think maybe my audio isn't working.
I got rejected. It's fine. I just wanted to actually ask if you could email or like Slack this presentation.
Pardon?
I was just hoping you could Slack the presentation, like the PowerPoint.
Oh yeah.
What we can do is we can put the video and the PowerPoint into the hub.
Yeah.
Yeah.
Yeah, that's fine.
Write this down, but I just don't have pen anymore. Yeah,
that's fine. Yeah, typically overstriding is the one that we see a lot. If you think back to that person before, leaning out forward, landing their heel right in front of them, that's a classic sort of overstride. And a lot of people, I think when they start to run, they try to kind of bring that leg out forward and kind of really stride out, which for sprinting, it's not too bad, but if you're trying to run distance more so, then it's not really going to work for you. It's inefficient, which we'll see in a second. You might find people who are too stiff. So if their knee doesn't load appropriately because it's sore, so people say with like patellofemoral pain or ankle pain, they'll just be really stiff through one leg and putting all the load through another leg. And that's something that we often see as well. And that might be something that is acute in nature, or it's something that their knee pain is actually gone now and the ankle pain is gone, but they're still left with this kind of gait that isn't efficient anymore. Too compliant is someone who's really spongy, like they hit the ground and they get lots of movement through their ankles, lots of movement through their knee, and that can lead to things like patellofemoral pain, Achilles tendinopathies, like more compressive based issues. Pelvic drop, which we'll see soon. Obviously that just like that classic Trendelenburg gait. Scissoring is where your legs kind of come across in front of each other, and that puts a lot of pressure through your glutes, your greater trochanter, so like looking for bursal issues, possibly ITB issues as well, but that will then lead down to the foot also. So you might also get tibial stress problem medially, or tib post issues because your foot can't handle the load. Yeah, and it's common to just find those generalized weaknesses across the whole body, across major muscle groups. And if running analysis can obviously be helpful, but if you're not going to address those common weaknesses, again, you're not really going to get better. You might be able to offload that structure, but that load's just going to go somewhere else at the end of the day. We've got Julian. So hopefully we can start this. So on the left, we've got his before, and on the right, we've got after. This should hopefully play for us. Yeah. Might take a little while. So what we did is we measured his cadence. And his cadence was about 170s, or I think it was 160s, and then we moved it up to 170. So here I am. This is what I normally do. I just draw some lines on people in general, starting from their hips. We'll see him running in a second. But you can see on the left-hand side, he really strides out quite a fair bit more. That tibia is out in front of him. So that's more of a classic overstride. If you think about the forces going through his body, they were going kind of back and working against him. So all his forces are going back and obviously not lending him to going forward and propelling himself forward at all. that will obviously put a lot more pressure through his knee, through his hip, through his back, and through his ankle. Where on his right-hand side, it changed a little bit. Obviously, we could do a lot more work to try to help with that. But that ideally, we want the tibia to be almost vertical on landing. And that doesn't matter if it's rear foot or forefoot or midfoot landing. If it's more vertical, the force is obviously going straight up or a little bit more forward, and just helping with more of an efficient running style. So let's see. That's also the line.
Center of gravity.
Yeah. So that's where you just measure those marks from. And an overstride is kind of classically the line between, like, pretty much the plumb line to the foot. The further away that you are, the more overstride that you actually see. Just 1 second. Need to go backwards. There is one where he's actually running. No. This one might have it at the end.
Here we go.
So you can kind of see at the end when in through here, when he goes to land on the left-hand side, he really extends that knee quite a fair bit and his toes pointing up into the sky a lot more than on the right-hand side. He still extends that knee, but he's landing more on the left-hand side. He's landing more right on the edge of the heel, and on his right-hand side, he's still striking at the heel, but his toes aren't as far up into the sky. And that then leads to him loading through that tibia a little bit nicer. And Julian, I guess one thing that we also found with changing the cadence as well, you felt as though it was smoother. That was one thing that a lot of people say. You change the cadence and you get a little bit more smooth as well, which is a common finding. And obviously feeling more smooth will lead to be a bit more efficient as well. Yeah.
Just a question, Jed.
Yeah.
Oh no. Have you ever brought someone's cadence down before?
I haven't, not yet. No. Most people come in really low cadence. And the good thing about a lot of these things is I measure it on an app called Tap That Tempo. And it's really easy. It's really easy to do. Where is it? Yeah. So it's called Tap That Tempo, and all you do is you press this button and you just follow their footsteps. So each footstep, bang, 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 and it will measure how fast they go. So their steps per minute, sorry. So you can do that. And then I can set it using a metronome and I'll go beep, 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 beep. So I haven't brought anyone's down, but what we can do is we can also see, like, through often their Nike watch or their Garmin watch, whatever it may be, we can see what they do normally. They don't realize their cadence is even being tracked half the time. They don't even know what it is. But you can go, hey, pull out your Garmin, pull out your Strava, pull out your Apple product, look at all the information and data, and it's like, oh, there's our cadence. And often it is like 150 or 155 or 160, which means that they're really stomping down on those legs quite a fair bit, which is really useful information that I guess people don't even access half the time. We do have one more here. I'll play this whilst I chat. So left-hand side is before, right-hand side is after. We put a line through the middle, which obviously changes a bit as Julian kind of moves around the treadmill as well. We generally try to put a line straight down the middle. Obviously, the left hand side, I went a little bit wonky, but you can see a slight difference before and after of his pelvis level. And you'll be able to see that when we play it. Often it's kind of that quality of movement and how you're actually loading. You'll find that when we play the video, the left-hand side, everything moves quite quickly and it looks like, you know, there's a lot of loading all at once, where the right-hand side, the hips are a little bit more stable, left and right. The hips are a little bit more stable left and right side, and just means that he's not loading through those legs as much. So we'll play that as well. So it's more evident once I take away those lines. Yeah, so you can kind of see through this area. On the right-hand side, he really loads through that right hip and it's a bit more stable, where on the left-hand side, there's a lot more up and down movement of the hips. It's subtle, but it really helps with controlling those forces kind of causing valgus at the knee, or like pronation through the foot, or you know, obviously if someone has a glute medius tendon issue or an ITB issue or a tib post issue, that's just going to help a lot of those problems by just straightening up a little bit more as we're loading.
And is the main difference that you did between the two, like up the cadence?
Yeah, there's up the cadence, and we also did a knee lift as well. Like we slightly lifted Julian's knee a little bit more, and that seemed to help as well. But a lot of people need a bit of practice as well over a period of time to actually make the difference feel comfortable. And so with Julian, we went up to 170 beats per minute or steps per minute, but really we probably want it slightly higher than that as well. So he's landing with a little bit more of a vertical tibia. This one's the scissor gate. I put this one on Instagram, but essentially it's the same. You draw a line down their midsection, down their spine, and you can see their legs or their foot crosses over in front of that line. And again, that just puts a lot of stress on the body. So that's him on his left-hand side. And then should show the right-hand side in a second. Should show the right-hand side. So that is actually better than his left-hand side. There's a little bit more room between his knees as well, a little bit more space between his knees. In here, you can see that section where the 90-degree mark is. There's just more air, which means that his knees aren't touching together as much. This is a guy I did yesterday. He tried to get Kelly into the room. His left shoulder was really, really high when he was running. And he said he'd always noticed it, and people always told him that his left shoulder was higher. What we did with this guy is just told him to relax his arm a little bit. You can see his left elbow is like slightly in an abducted position as well. So he's kind of running like this a little bit more with his shoulder up. He did say he had like a previous history of a left shoulder issue, but when we're going to kind of drop it a little bit more and kind of use his arm a bit more as they call it, like a pendulum motion, so nice and smooth and swinging. That's like the fixed point running down here, a nice smooth swing. It just made him feel a lot more efficient. And also, if you're doing this the whole time, I don't know if any of you've experienced it before, but like the first time you go out for a run, sometimes like you're getting headaches, like a lot of muscular tension up through here because people tend to like run like this when they start to get really tired as well. But this guy just developed a bit of a habit of it. But we can make him more efficient by relaxing those shoulders a bit more, getting that arm swing to be a bit more smooth and fluid, and that helps quite a fair bit for this individual. You can also see his head position has changed quite a fair bit as well, so he's more up and down. Okay, just 1 second. Okay, so this is Haley the other day as well. On the left was before and on the right was after. And again, this was looking at arm swing. So have a bit of a look at this. Whoa, don't know what's going on there. Let's try one more time. I might just do this. So you can see our arm swing was really, really quite high. It's really high up there. And so that's kind of not too efficient for it. So what we tried to do, we tried to modify that a little bit to try to get it down a little bit further. Just have to take it slowly. There, we tried to get it down a little bit further so it wasn't as high for her. Because not only was it swinging, was it holding arm up here, but she was also kind of swinging up in this direction as well. And it just wasn't helping her really at all. But she kind of overcompensated then, which often happens, and she dropped her arm too low. Ideally, you kind of want it up a little. You want it a little bit more here. Yeah, not too low, but not like really, really high. That was about it. Any questions that people would like to ask?
What if when you're doing the scissor gate sort of assessment, do women tend to have more of that? Like, is the because of the Q angle of the female? Like, is that just more of a common thing?
I think it's probably more relation to weakness through the hips rather than exact. Like they might look like they have more of a valgus, but it doesn't necessarily mean that they're going to scissor in across of each other. And a lot of the evidence kind of says like, yes, like women do get a lot more of that, the like glute medius tendinopathy and trochanteric bursitis type of issues, but often it's probably not necessarily related to that kind of that biomechanical difference. It's often related to loading it more, like, and I'm kind of a firm believer that it's often more of that overload rather than the specific biomechanics. We can reduce the load on that structure by changing the way their biomechanics work, but again, they have to make sure they're loading adequately. But I guess to answer your question, at the moment, I haven't seen that exact difference. At the moment, both males and females seem to both do the same sort of thing, and often it correlates to weakness in the hip. There's the guy that I recorded the scissor gate on, he was distinctly weak on the right-hand side, or one of the sides, I think it was his right. And that was the one that was his injured side. He'd had glute issues before, that kind of dull nagging sort of sensation, and sore in the morning, sore after running. And that was his symptomatic side. So, and then when we tested him later isometrically, it didn't have any strength in it. So he found it very useful to have the feedback from the assessment, plus knowing that that muscle was weaker. Yeah. Anybody else? Anybody else? Nope. Well, thanks for listening in.
Thanks, Jed.
Got a little bit out of it.
Thanks, Jed. Thanks, Jed. Thank you. Thanks, Jed. Thanks, Jed. Thanks, Jed.
So, Nick, are you going to do the next one?
Pardon?
Is Nick going to do the next one on his
I'm
bike
not sure,
fit?
is he?
Yeah,